Dr. Jessica, welcome to Run with Fitpage. It's an absolute pleasure to have you with us.
Thanks so much for having me, Vikas.
Like we were discussing backstage, there is so much need for us to understand more about heart. I think it is for the heart of things that we run and we keep running. And at times, we do not know a lot of things that goes on within the heart and how it functions, how it helps us, how it not. And I thought we'll try to unravel some of it. And your research has been a lot around elite athletes, but as you know, and I see that as well, that a lot of applications are similar. The basic principles are pretty similar, so we can draw certain analogies for sure. Before we get into that, how about we start with an introduction of yours, where you come from, what you've been up to so far?
Absolutely, sure. So I'm a researcher in Sydney, Australia at the University of Sydney, and I have a Master in Public Health and then a Ph.D. in cardiac screening, both for elite athletes and also cardiac screening for rhythm problems in older people in general practice and primary care. So a lot of my work looks at how can we do it better, how can we protect the heart and make sure people are active enough for their health as well.
Awesome. And do you run as well?
I do, yes. I love it.
Awesome. How about we start from the basics of heart to start with? What is heart? What is it made of? What are the basic functions? Just right from there, very elementary.
Yeah, absolutely. And it's a really good place to start. So for most people, the heart is about the size of a closed fist, and the heart is a muscle. So it's made up of 3 layers of tissue called the epicardium, myocardium, and endocardium. And it's really the center of the body's circulation system. So the heart has 4 chambers, 2 upper chambers called the atria and 2 lower chambers called the ventricles. So on the right side of the heart, the right atrium and ventricle work to pump oxygen or blood to the lungs. But on the left side, the left atrium and ventricle combine to pump the oxygenated blood that's been to the lungs back around the body. And also for your heart to keep beating, it's important to understand that it uses electrical signals which tell the muscles when to contract and when to relax. And so this conduction system is the heart's pacemaker, and it sets your heart rate and rhythm. And it also allows the upper and lower chambers to talk to each other and communicate and work together efficiently.
Wow. It's almost like a circular recycling system in certain ways, right? That the oxygenated blood is going through the body and then it's coming back to the heart for it to recycle, isn't it?
Yeah, absolutely.
Awesome. As we grow older, we've seen people pick up running for the purposes of getting fitter. And one of the things they always say and see that if you do cardiovascular activities, that improves your heart fitness. And every screening, every health checkup we go to and we meet doctors, this is something that also keeps coming from doctors, where they promote exercises to improve the heart fitness or health. I wanted to understand from you how exactly exercise helps improve the fitness of the heart.
So it's really important to understand that it's such a positive and powerful tool for your overall health. Exercise, I couldn't speak more highly of it. So it improves not just your cardiovascular health, but all your health. And it does this by really improving the efficiency of the heart muscle. So the heart is a muscle like other muscles. The more you work, the more efficient it gets, the bigger it gets, and it improves your circulation. But it's also important to remember that it's good for reducing cancer risk, improving your well-being and mental health, and it's really good for pretty much every other chronic disease state that we know of. And so they say if exercise was a pill, literally everybody would be taking it. It's so powerful. And so I think our biggest problem, as you say, is that a lot of people aren't doing enough. And so really what you have to do is find something you love so that you can keep doing it. And it needs to be something that you can build into your life and do regularly. And then once you start doing that, it has a powerful effect on your cardiac structure and your function. Your heart will move faster as you start to exercise. Your circulation will increase. Your body is demanding more of that oxygenated blood for your muscles demand increases, heart rate increases, and your heart will pump with more force so that your heart rate and your stroke volume increase, and that increases cardiac output. So everything goes better as you exercise, and those benefits persist even later in the day when you're not exercising, and that's important too.
Yeah, that was the point I was coming to, that the stroke volume increases, you are exercising, your heart is running faster, but as you start to then rest through the day and you go on with your normal life, it continues to improve through the day and the next day as well, right?
Yeah, that's right. And as you exercise over a long period, your heart adapts to this exercise. And that's why athletes and often runners have a lower resting heart rate than people who don't exercise. Their heart becomes far more efficient. It just doesn't have to even beat as often. It's just working so well.
Awesome. Just because you talked about the lower heart rate, resting heart rate, I wanted just to digress here a bit and understand, will this mean in normal healthy people, a lower resting heart rate is a sign of better fitness of the heart?
Yeah, it often can be. So your heart's bigger and more efficient, and it can stay almost a little bit half asleep some of the time. So in some really highly trained endurance athletes, they have a heart rate in the 30s, 30 beats per minute, which is very slow. It's common for runners to be in the 40s or 50s as well.
That is correct. Yeah, I keep seeing the moment I'm at 51, 52, I start to get worried that it's too fast now. And when it's in early 40s, I feel much better psychologically as well. So it's also sign. And I have seen anecdotally for me, over the years as I train, it's significantly better. And as I don't train for a few months, I see it keeps going down. It will go from 44, 45 to go to 51, 52, and so on. Now, this may be happening because of the effect of non-exercising. And so I wanted to understand from you is, if you stop exercising or if you reduce your exercises, does the heart fitness reduce? And if it does, then how does it actually take place?
Yeah, it definitely does. And I guess the first thing you have to say is there a good reason that you're stopping your exercise? And if there is, if you're doing that on medical advice because you have some other condition, then that's obviously important. But if you're just finding that you're too busy or something, then yes, you're absolutely right. So basically, you start to lose your training adaptations. So all the things your heart was doing when you were training, getting bigger, getting more efficient, they basically start to reverse. So you start to get a decrease in blood volume, less blood's returning to your heart with each beat, and your body might try to compensate by increasing your heart rate a little bit so it's not quite as slow. Your heart might actually start to get a little bit smaller and not be quite as big as it was. And your VO2 max, so your maximum oxygen uptake, can actually start to drop within 2 to 4 weeks of pretty much complete detraining. And when you look at this, there was a very famous study which was actually discussed at a conference I was at on sports cardiology on the weekend, and it's called the Dallas Heart Study. And in this study, they took 5 healthy 20-year-olds and they put them on bed rest for 3 weeks and basically watched what happened. And they found that effectively 3 weeks of bed rest had a bigger effect than 30 years of aging. And their average VO2 max declined by 27% in that time. And so it was really amazing to see how profound those effects were.
Wow. I was just going to almost volunteer that I wouldn't mind bed rest for some time, just to rest and sleep. But after seeing the outcome, I definitely don't want to wish and be a part of it for sure. Wow. Okay, that's important to know, because what I have seen also is recreational athletes, as they start, they do really well during the season, and as the summer starts here in India, and we are at the cusp of now the summer coming, we see that almost everybody stops to exercise because they think it's too warm. They cannot get out early in the morning, and then they will wait for 3 to 4 months before the next season starts and they start to train, and they think and they hope that the training that they had earlier, the body will remember it and they will stay as fit as they restart, which is not the case. And possibly that's also one of the reasons when the paces are too fast, people start to get injured, etc. I've also seen from experience in speaking with people for nutrition, that is, once they go on a diet plan, on a nutrition plan, say for weight loss, they hope and imagine that after they have achieved that stage of weight loss, they want to reverse their diet to being normal and still expect that the weight should not increase. So I think they should take it with a pinch of salt, that if you stop doing it, what you're doing regularly for good, I think it's not going to do any great for your body, isn't it?
Yeah, that's right. You really have to find a way of building exercise into your life regularly. But that said, I can completely appreciate that the summer conditions do provide really substantial challenges, especially for running. And if you're going to be out in the heat of the day and if it's humid as well, you do have to adjust to those conditions. That's very important too.
Yeah, yeah. Honestly, I use it to our advantage, where we say, okay, let's be heat adapted. Try to run a little early, and in Mumbai, it's pretty humid too. So on an average now in the summer, we'll find 85% humidity, which is pretty bad. So we try to run early, and we call it poor man's altitude training. That's what we try, and keep it with a good aerobic base, so that it helps us train during the season. Now, moving on to the next point, that is around cardiovascular exercises versus strength training. And primarily for runners, either we like doing cardiovascular exercises or we love doing the strength training workouts. And there's always a debate which one is better. People want to look at muscle hypertrophy. They want to be aesthetically larger built, very muscular, but at the same time, they also want to run fast. But from heart fitness point of view, what in your opinion is better? Is it both? Is it one better than other? What do you think?
So that's a really important question. And I think the answer is that using both are very important for not just your health, but also for your running ability. Although if you're looking to improve your running, the sort of strength training you might do would be different than if you just want to build a nice look in the mirror. So they might be different things. But current guidelines recommend both. The Australian guidelines recommend that you do some resistance training at least 2 days a week, and that also that you do cardiovascular exercise most days of the week. So the answer is probably both. But as you've said, the biggest problem is that most adults aren't doing enough. And so you really do need to find something you love and build up gradually. If you like weights and that sort of thing more, then it's okay to do more of that. But you shouldn't ignore your cardiovascular as well, because that improves your heart health and burns more calories, while your weights, builds muscle and strength, boosts your metabolism, and absolutely can help you run faster if you're doing the right sort of targeted program. And so the other point is all of these cardiovascular exercises as sort of vigorous activities that increase your heart rate and breathing, and you raise your oxygen and your blood flow throughout the body. But it is fair to say that some exercises are more intense than others. And so sometimes they talk about the talk test. So can you still speak? You're doing, and so you may need to do more if you're doing a lower intensity to get the same benefits. But at the same time, as one of my colleagues says, your heart can't actually see what shoes you're wearing, but it can feel the effects. So whether you're doing swimming, walking, running, as long as you're doing enough of it to get those benefits, your heart's enjoying the effects.
Got it. Now, you talked about talk test, and this is something that beginners primarily struggle with a lot more than more experienced runners. That is, that when they start to run, they run a little too fast, and they're almost exerted all the time, and they think if it's hurting the next day, it's fine, because no pain, no gain kind of methodology. I wanted your help to just, now that you mentioned about it, can you talk through what exactly a talk test is for a runner, and how should they know that, okay, this is the talk test, and this is how at this pace or this intensity they're working, so it's going to be right for them or not?
Yeah, absolutely. So the talk test is kind of a loose way of measuring the intensity of your exercise. And so how much can you talk while you're doing that activity? So a moderate intensity activity, you can probably talk, but you might not be able to do singing or much more. Whereas if you're doing a more vigorous intensity activity, you can say a few words without pausing for breath, but no more. And so they usually divide it, I think, into 3 levels. And which level you're at really depends on what you're trying to achieve and how far you're going and what stage you're at. So I think there's a lot of different schools of thought about how intensely you should be training at various stages, and obviously it really depends on your goal. Sometimes I think it just depends a little bit what you like. Some days, if it's been a stressful day, I love to go out and smash it hard, and I don't want to be able to talk at all. I want to be able to think, listen to music, and just enjoy that feeling. Whereas other times, if I'm running with a friend and we're talking, then we dial it back a bit so that we can talk, and that's nice too.
Yeah. No, I completely agree. And times when I have hard day at work, I want to just get out and run as fast as I can, and I do not care whether I can talk or not. And it has its own benefits. I feel like when I'm absolutely at loss of everything, that I just cannot feel anything when I'm running too fast. By the end of it, it's just so exhilarating because you felt you could push yourself, and for a minute you feel that you're away from the stressors that were there through the day, whether it's occupational or anything else. So I completely agree. Now it seems like and from the entire conversation so far, what you have alluded to, that is that cardiovascular fitness is not alone for weight loss, not alone for just normal fitness. I think it's important for overall fitness and longevity itself, isn't it?
Absolutely, that's right. So weight loss can be a benefit, and particularly, running burns calories very efficiently for the time involved. So if you like it and want to lose weight for health, it's absolutely a benefit. But as we've said, all the benefits of cardiovascular exercise are there as well for you, and very important for everyone, weight loss or not. I think we talk about weight as a modifiable risk factor for cardiovascular disease and other injuries. And so that's one of the ones that exercise is really good at helping reduce that as a risk factor as well, if you think of it that way.
Yeah, makes sense. Now coming to the other side of the spectrum, that is, as you start to train and you are an endurance athlete, at times even at elite level, we've seen a number of cardiac issues, and so in my understanding, I thought it could be because of training, or it could be because of any underlying diseases or preconditions. But I wanted to just open this for you to help us understand what exactly is going on. Is it real that running is causing any kind of cardiac issues, or it could be a combination of a few other things?
So there's a few aspects to this, and it's a really important point to think about. So we always start the answer to a question like this when we work in the area by saying, well, let's start by remembering that athletes on average have excellent health outcomes, and that all the benefits we've talked about are so important. That said, there's a small subset of athletes where high levels of endurance exercise can potentially damage the heart a little bit in the electrical remodeling, and that can lead to some scarring, which can cause heart rhythm problems. So that's we see that more commonly in male endurance athletes, and especially at older age, so a lifetime of endurance activity, and you can get some heart rhythm problems, things like atrial fibrillation, where the heart has an irregular rhythm that begins in the upper chambers and can present like palpitations. So that's sort of one subset of things that can happen. When we look at young athletes, and there's some very public and very sad cases where they have collapsed from sudden cardiac arrest on the pitch, that's a situation where you're looking often at a genetic heart disease, that's something that they may have inherited from their parents, and that's quite a different thing. In all cases, it's really important to seek help if you've got symptoms, if there's something you're worried about with your heart, or if you have had a relative die before the age of 40 due to cardiac causes or an unexplained reason. If you've got a family history like that, that's a very important thing to look at as well. So I guess it depends which part of the population you're looking at, what are the sort of primary causes of those things. But in all cases, any symptoms or bad family history should be investigated.
Sure. I think we should spend some time here because most of our listeners are they are older athletes where they're amateur athletes, they have day jobs to themselves, and because runners are very social, and so we keep hearing of information that that occurs at any stage with any runner, and at times it starts to scare people. I wanted to understand from you, in older athletes, the point and symptom that you talked about could be a palpitation like symptom or something similar. What would you think, one, how to first diagnose it, and then second is, what exactly is this condition called? How and why could there be an irregular rhythm of the heart, for example?
Yeah, that's a really good question. So it's very common. People report palpitations all the time. And if you're someone who's feeling palpitations, it does not necessarily mean that you have anything too bad going on, but it may do. And so, as you say, the biggest thing that you can do is work on getting an accurate diagnosis. So for all of these heart rhythm problems, a test or called an electrocardiogram or ECG is really what you need in order to figure out what's going on. And so there are actually a lot of portable ECGs that you can get now. You can even do them on your watch. You can get them on chest straps. You can get a little one that works with your phone. And so if you're finding that you get those sort of palpitations or arrhythmias when you're out and about or when you're running, you can actually get one of these consumer devices and stop and take a recording of your heart rhythm. And that's very, very helpful for your doctor in trying to work out what's going on. And so pretty much all of these conditions need an ECG to diagnose them. Sometimes you don't have to get your own device. You can go to your doctor. They might do what's called a resting ECG, or they might do a stress ECG where you jump on the treadmill or a bike with some sticky dots to measure your heart's electrical activity and see what's going on. But it is sometimes the case that these arrhythmias are only occasional. Maybe they're only every few weeks, or when you're somewhere maxing out your heart, running up a hill in the heat or something. And that's where those portable devices can be really, really helpful.
Okay, in that case, it could be right after you feel it, you should try and do the ECG yourself, right?
Yeah, that's right. So if you can capture what's going on with the electrical activity, it will help your doctor figure out a lot, whether it's, just a few extra beats, or whether it could be atrial fibrillation, atrial flutter. Another condition called supraventricular tachycardia, when the heart's going very fast, but it's coming from the top part of the heart. And hopefully it's nothing more nasty than one of those. And a lot of those in endurance athletes, they're kind of a little bit in the category of an annoyance. So none of those rhythms that I've mentioned are the kind that are likely to make you suddenly collapse, but they might be the kind that impede your performance, and there might be some things you can do about them to make them not so intrusive. So it's still really important to get the accurate diagnosis.
Sure. And of course, this will reduce your stress too once you know the exact diagnosis, because something that's unknown, it's always more fearful. Now, in case of arrhythmia, what exactly is going on and why does it occur to start with? Like, for example, if I'm a healthy individual and I see in my regular health checkup I'm all okay, and I'm training, do you think I could still have this condition over a period of time? And if it is, then what exactly is happening that may be happening because of training, for example?
That's a really good question, and the answer does depend on which arrhythmia you might have. But if we talk about something like atrial fibrillation, which is one of the very common ones that we do know in some people is associated with intense exercise, that high level of endurance exercise can relate to electrical remodeling in the heart, which can lead to myocardial inflammation or even a little bit of scarring. And that can sort of affect how the electricity flows through the heart and can lead to that sort of irregular heart rhythm that begins in the upper chambers or the atria in the case of atrial fibrillation. And then it can impair your cardiac efficiency and affect your exercise capacity and performance. And I guess there are still a lot of unknowns. So as I mentioned, it's more common in men. There could easily be a bit of a genetic component as well. So some people might be more likely to get it as well. So it really is interesting. But there's this very interesting study of Swedish skiers that had completed these long distance ski races cross country, and after 9 years, they found 1.2% of them had atrial fibrillation, much more in males, but those with the fastest finishing time and the most number of races they had completed had the highest chance of getting that arrhythmia. So the more they'd done and the faster they'd done it, the more at risk they were. And having said that, though, even though they had that heart rhythm problem, they didn't also have a high stroke risk. So usually atrial fibrillation is something that in people who don't exercise much, the worry is that it can cause a blood clot in the heart, which can lead to a stroke. So even though there is a bit of atrial fibrillation sometimes in endurance exercises, we don't also necessarily see the same risk of stroke, which is an interesting finding.
Got it. And do you think, other than this, could there be other types of cardiac screening that people should be aware of or be looking at at a regular interval, other than palpitation being one symptom? I generally try and I see my cardiologist every 1 year, and we go through the entire cardiac profile, and that helps me. But I've seen a number of my friends, they do not think it's important, and they keep charging. They also think that because they're runners, they're almost immune, and they're runners because they want their heart to be strong and good and healthy. Do you think there are other, either symptom based or any other way through which they can screen what's going on?
Yeah, absolutely. So when you talk about screening, it's really important to think about which population you're looking at. And so if you're looking at young athletes, that's a different type of screening. So in the elite sports, a lot of the elite sports are doing that sort of thing. What you're looking for there is the more genetic heart diseases, and you're often doing an ECG. If you're looking at people aged over 30 to 35, what you're really looking at is more risk factors for coronary artery disease. And so that's not something that you'll see on an ECG, but it's really important to think about those other risk factors. And just because you're a runner does not give you a complete free pass. So if you've got high blood pressure and you're smoking, or you've got other things like cholesterol, things like that you can really have a good look at, it really is important to look at those things. I think what you said about symptoms is incredibly important. So if you've got a symptom, and especially if it's something like fainting, unexplained collapse on exercise, anything that's worrying you, chest pain, the sudden feeling of a loss of a cylinder, that is absolutely super important to follow up. And so while we're not always perfect at predicting who is going to get heart disease, cardiologists are very, very good at going through people with symptoms and figuring out whether it's a cardiac cause or not. And then I guess anyone who's got a family history, as I said, if you've got a family member who's died suddenly at a young age, especially if you know if it's cardiac, and by young age we often say under 40, then it's worth having a look. And depending on where you're coming from with any of those factors would depend what sort of tests the doctor might do. And I don't think people need to be worried, but I do think it's important to just keep an eye on those things that you can do.
Yeah, no, I completely agree. And the point where you said, just because the runner doesn't give you free pass, it's extremely, extremely important. And we must not live in overconfidence bias, and also in negation that either nothing is going to happen to me, or I'm just, if I neglect, then things are going to be okay. I mean, these are issues that might happen to anyone, and we should accept it as is and try to find a cure if there be a situation. I'm moving towards the last question, that is that's around actually higher heart rate, and this was not something that we discussed, but it came just now as we were talking. That is, when people are running, I always see a lot of posts on Instagram and other places where people say, hey, their heart rate was unusually high today, or earlier their heart rate they saw for the same effort was lesser, now it's higher. What could be going on beyond the accuracy of the heart rate monitor itself, to be honest, because the number of wristwatches are not necessarily accurate. But if people are seeing higher heart rate, could this also be an indication, and to what degree, or it could just be because of not a better sleep or something like that, for example?
Yeah, that's a really good question. So you've already raised one of the important points, which is whether your device is accurate. My cardiologist said to me when I said the exact same thing, said anything over 180 it's very hard to be accurate anyway. And then your second question is probably going to be, what were you doing when you noticed that? Was what you were noticing with your heart completely disproportionate to what you were doing? So if you're absolutely flying up a hill at the hardest possible pace, your heart's going to be going fast. But if you're sitting there just walking and all of a sudden it jumps in a way that worries you and you notice it, then that might be something that you need to look at, because maybe something's changed. And so the other thing is, are you noticing any symptoms, or have you just looked at a number that's on your wrist or your chest monitor?
Yeah.
And sometimes if you're just looking at a number, maybe it's not super important. But if there's something else going on that you feel is a bit unusual, then it is worth investigating. And it's really interesting. So I know you're a country that loves cricket, and we know that a lot of cricketers monitor their heart rate a lot. And one of the great Australian batters in the days after his COVID vaccine noticed that his resting heart rate was about 10 beats per minute higher than it usually is. And so sometimes there might be something else that's going on, and it might not be a big deal. I think it went back to normal a couple of days later, but it's an interesting thing. The more that you monitor, the more that you notice as well. And so I don't think there was any worries with him, but just because you're looking, So, yeah.
Yeah. And I think something to note that is that you should be observant. You should be aware of what's happening with your body, but not be in stress or keep waiting that, hey, next time I'm watching it, maybe something is going to go wrong, because then you'll be a lot more stressed about it than actually just looking at these numbers and objectively thinking of if at all there is any abnormality, how to address it. I've seen situation I remember about a month ago at work. I had an employee and she was sweating, and I said, what happened? She said she was wearing a new device, and she saw her heart rate jumped by 10 beats while she was at work and sitting, and she thought there's something terribly wrong, and she started stressing about it, and that raised it further. And she then she spoke to me, and I was like, just calm down, take a deep breath and see. While I'm not a doctor either, but it was just that her device was faulty, and she found that out later. So I think looking at it objectively makes a lot of sense, and we should be thinking that we are going to solve for a problem. If it exists, then either stressing about it or negating that it will not happen to me at all.
Yes, absolutely. It does get difficult to untangle different symptoms once you get worried about something. Sometimes that can raise your heart rate as well. So I completely appreciate that's tricky.
Yeah, agree. Awesome. This was a nice little masterclass, and I think I enjoyed, and our listeners will enjoy as well. Before we sign off, I want to see if there is anything else that you would like to say for heart health in general, and also how people should be able to reach out to you if they are interested in seeing your research and what you're working on.
Yeah, absolutely. So I think the summary is that exercise is super important for everyone, but that's it. Just because you do exercise doesn't give you a complete free pass. So if you've got other modifiable risk factors that you can work on, like smoking, diet, blood pressure, cholesterol, you need to look at those. And then also, if you've got any kind of symptom that's worrying you, get it checked. Just because you're very fit doesn't mean you can't have a problem. So if you're worried about something or have a bad family history, absolutely go and get it checked.
Awesome. And how should people be able to see your research or work?
You can find me on Twitter. I'm Jessica J. Orchard, or I have a website with all my publications on University of Sydney, which I can send you the link for.
Awesome. Yeah, it will be a pleasure to put that in the show note as well. Dr. Orchard, this was fantastic. Thank you so much for being with us today, and I look forward to staying in touch.
Thank you so much, Vikas. Pleasure to be here.
Take care. Bye.